Western Cape government, who's the climate and utilities champion. And we will understand in a moment what we mean by that. And she will be talking to us about sustainability within the healthcare, which I think is a topical issue, given that the advent of the extreme weather events, which are becoming more and more prevalent as well as intense. It is important to wrap our heads around how, as government, we can respond to some of these challenges. Martjie does work for the government in the Western Cape, and she'll tell us everything about what the Western Cape is doing in that respect. Similar to how we usually do these webinars, we will start with a presentation from Martjie, and thereafter we can have our contributions in the form of comments, inputs, question and answers, and so on and so forth after she has delivered the presentation. Without much further ado, Martjie, welcome, and over to you.
Thank you so very much for your kind introduction, Boitumelo. I really appreciate it, and thank you for the honor to be here this afternoon. I'm really excited to know all about this knowledge sharing thing. I'm all for knowledge sharing because I think together we can do so much more than just us carrying on our own. So permit me to share my screen with you guys. So I've got load shedding on my side, so apologies for that, but I'm sure everything will hold here. Sorry. I just want to know if everybody can see me now. That's okay?
Yes, that is absolutely fine.
Okay,
thanks.
Perfect. I'm going to switch off my camera for my presentation just for everybody's bandwidth. But yes, as Boitumelo has very nicely indicated, my name is Martjie Cloete, and I am the Climate and Utilities Champion for Department of Health in Western Cape Government. And we have been embarking on a net zero journey since 2020. And this is just basically our story, what we want to do with regards to sustainability within healthcare. So if I'm going to take you through the index quickly, we've made a pledge to Global Green Healthy Hospitals, and then we've got an energy services company and how we're going to get to our net zero. What are the projects to date? Remote metering, water management and augmentation, how we handle waste management. We've got an internal awareness campaign, how we're planning on getting to race to zero, and then a little bit about what I can do as a person in terms of climate change and the current energy crisis. And then I will add a bit of a cheat sheet so that people understand how much it costs when you do electricity. Not everybody necessarily understand a kilowatt hour because that's not necessarily tangible, but everybody understands how much 1 rand is. So I will take you through the presentation, and then you're welcome to ask me questions afterwards. Okay, so our pledge to Global Green Healthy Hospitals was made in 2020, and we committed to become net zero carbon by 2050. If you can see, there's 10 different types of agendas that GGHH has. So it's leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals, buildings, and purchasing. So at the moment, we're very much looking into the energy because of the energy crisis. We're also looking into water and waste. And we're also looking into how we're going to change the plans for buildings, making sure that they are energy efficient. And also when we design buildings to ensure that they are operationally functional as well as energy efficient. We're also looking into some green procurement that is going on behind the scenes, working very closely with supply chain management, and hopefully at one stage we'll get all the big pharma together and ask them to maybe change some of their packaging so that it is more friendly towards the environment. So we joined the Healthcare Without Harm community in 2015. And we already reduced our Scope 2 emissions with 10% by 2020, based on our 2015 baselines. So Scope 2 emissions are emissions that is generated off-site, so it's typically Eskom power, and that is burning fossil fuels, and we would like to bring down our demand on fossil fuels. So as a whole department, we committed to reduce our carbon footprint. It is also, we're not working on our own. We're also working with our provincial environmental department, and they came up with a provincial climate change response plan. And this is our objective forms part of their objective too. So we're not we're not in a silo here. We all work together to ensure that the province becomes net zero carbon. This is also in line with what National Department of Health would want us in terms of reducing our emissions, and as well as the National Department of Environmental Affairs. So it's not we're not a lone ranger in terms of this. So just to show you just a quick indication of what scope 2 is. So there's 3 different scopes. Scope 3 is the most incomprehensive one, whereby you're looking at waste, water, contract vehicles, travel, etc., etc. So all of that forms part of scope 2, but we decided to just go for scope 2, which is electricity offsite. Yeah, so how are we going to do this? So we have got a very good partner in terms of an energy services company, and that's basically our main vehicle to achieve net zero carbon. So what they do is typically energy audits. And by energy audits, I mean they go into a facility, they count the amount of lights, they look at the HVAC systems, they look at the hot water system. So everything is looked at globally and holistically. So, as you know, if you do some retrofitting, immediately your HVAC system is being affected because you don't need to have as much cooling, because the older lights are generally quite a bit warmer than what the new LED lights are. So we look at a whole facility approach, and they identify the savings opportunity at a facility. The nice thing about this is the fact that they invest their own capital, and the savings are measured against agreed upon baseline. So the baseline is 36 months worth of municipal data, and that baseline is presented to us as a department together with the audit report as well, which contains the different interventions that they are planning on installing at the facility. So we will then peruse the document, and we will go through and see what is possible and how, and if we can, if we indeed are allowed to, with regards to different projects going at facilities, if we can proceed, and then the contractor will then do the interventions at particular facilities. So if you look at the graph on the left-hand side, you'll see the top line is the actual baseline, and the one at the bottom is the savings. And then you will see the department and the contractor will share in that savings. So your effect on the municipal bill, if you look on the right-hand side, if your municipal bill was 100 Rand and it is now 60 Rand, 20 Rand of that will go to the contractor, and roughly 20 Rand of that will go to the department. It is advised that this savings that you get from the shared savings program is then ring-fenced to make sure that that can go into maintenance going forward. It doesn't always happen, but it is advisable that that is an option. The annual carbon savings for Red Cross Hospital, which is one of our facilities that we're implementing these shared savings programs, is it's roughly about 250,000 trees per annum. So there's a lot of carbon to be saved, and also a lot of electricity to be saved, and also a lot of money to be saved. And that also means that the facility is being upgraded at no cost to the department. So it's a very clever way of funding. And it also is important to note that the contractor is responsible for the maintenance of any intervention for the period of a task order. So the ESCO investment at Red Cross Children's Memorial Hospital is almost about 10 million Rand during the project life cycle. Now, the reason why I say life cycle is this project is currently underway, so they are starting to do retrofitting, and the lights that they're installing has typically got about a 5-year warranty. So they will last at least 5 years. The lux level is higher than what it's required with regards to OSH Act. And the lights will be changed the moment it becomes lower than the required OSH Act, or when it reaches the required OSH Act level. And this is typically going to be about year 6 or 7 generally. And that means that the department is possibly still going to have fairly new lights by the time the period is over, the task order period is over. So what I mean by task order is this is an NEC3 contract. NEC is a new engineering contract, and it's a term services contract, so we only appointed one contractor. And the contractor is then issued task orders for every single hospital. So an intervention task order typically is only allowed to be 5 years in terms of the contractor's payback, and we then double this time for the contractor to make a profit from this engagement. So Realnet will typically, that's our ESCO partner, they will typically invest their own money, which is almost 9.7 million. And they will do the project management. They will put in the materials, the consumables, the labor, the everything. They basically do the project management from their side. So it's a very, very low intervention project from a departmental and from a management point of view. There's some management that we have to do, obviously, but it is a fairly easy vehicle to achieve net zero. So what they do at Red Cross, they're looking at HVAC programming. This is mainly making sure that all the set points are optimal, looking at air conditioning and gas changes, at especially the split cone units. Lighting will do retrofitting, occupancy sensors, behavioral change, heat pumps, making sure that all those are at their optimum COP, which is the coefficient of performance. Compressed air pump systems, and then we'll also do some power factor correction. That is not really going to impact your electricity consumption much, but it will affect you from a cost point of view. So the benefits of an ESCO contract. The nice thing is this is a performance contract. So the contractor invests at their own capital. There's no capital required from the department. The contractor carries all risk. If there's no savings showed, there's no pay. So if I can just take you back to this graph here, if there's no savings, there will be no payment for them. So if the savings remains at the baseline, there's just no payment for the contractor. They provide the maintenance on all the interventions over the period of the task order. This can be up to 10 years. Once the installation is done, it becomes part of the departmental asset register. So if there's a heat pump or something like that that will be installed as part of the program, that becomes our departmental asset. This is also a fit for purpose interventions. It's turnkey, it's holistic, and there's a lot of years of intellectual property that goes into this type of solution. We're also looking at green job creation, skills development, and capacity building. We also make use of the EPWP, and this has been quite successful. And the concept's not new. It's been around since 1997, and Public Works and Infrastructure has had amazing savings with regards to these sort of shared savings or performance-based programs. So what are we doing currently? I first can show you our success story. This is Eerste River Hospital. It's right next to Khayelitsha. So if you can look on the left side of the graph, you'll see that the base load there is pretty high. And we started doing our interventions in September last year. And you can see there's been a drop of about 25 to about 30% in terms of electricity consumption at this particular facility. So we did retrofitting, we made sure that the hot water systems are optimal. We made sure that all the COPs were properly set, and make sure that all the HVAC set points are optimal. So we are constantly busy at this facility. So the contractor will never, they go offsite after the initial installations, but they go back on a regular basis to ensure that all the lights are still in order, that all the set points are still optimal. So it's never, an installation and they walk away. The contractor has a very good relationship with us. We have to, because we've got a 10-year project that we're working on. So we work quite closely with the contractors. The contractor also work quite closely with the people on site as well. So the relationships with regards to this project is very, very important. So Red Cross, as I said, and PAL regional hospitals, they are currently underway. We expect them to be finished by about May of this year. We've done some just lights installation at Lentegeur Laundry in August of 2022. Some other things that we are busy with, we've got 12 other energy audits underway throughout the province. That is anywhere from Beaufort West to George to Vredendal, and Ceres. So it's literally throughout the province. And the other thing, because of the current energy crisis, we've issued task orders for clinics, which aims to address load shedding and energy efficiency. That will take us to net zero over time. But for now, we will address the power crisis at the clinics, because unfortunately these guys are unable to really assist patients properly. I was quite shocked when I saw that, you know, all these consultation equipment that you require, you know, looking in people's eyes and ears, and, you know, even measuring blood pressure is impossible because they are all electric. And even dispensing medicine is not possible without any electricity. So we are busy we're now currently doing site visits to ensure that we can equip 51 of 120 clinics with inverters and batteries, and the next 70 will be done towards the end of the year and next year as well, just to ensure that the clinics are now equipped with battery power. This is also in line with the National Department of Health's letter that was issued by the DG to ask that all primary healthcare facilities are equipped with backup power. Now, just some quick pictures to show you what has been done. These pictures have not been tampered with. This is really what it looks like. This theatre was not in use for about 2 years before we installed the lights. It was basically just because of COVID, the elective surgery that they postponed, but now this theatre is in use, and the feedback that we've got was very, very positive. The feedback from East River in terms of the lights was also very, very positive. The guys are very happy with regards to what has been done at the particular facility. This is Lentegeur Laundry. As you can see, we've installed lights here. This is the sewing section where they mend you know, gowns, sheets, whatever needs to be mending. So there's a sewing section within the laundry. This is our canteen in the laundry. And as you can see, this is the dispatch area. And if you look to the right bottom of this, both pictures, you can see it's pretty much out of the same place. So this is the before on the left. It's the laundry manager in the middle there, and on the right, it's what it looks like after all the lights have been installed. The lux factor on this lights is sitting at, I think, 680, and the OSH Act's requirement is about 500. And why it's important that the lux level is higher is because in 5 years' time, because lux levels dims with a certain percentage over time, it will most likely still be acceptable with regards to the OSH Act. So it's advisable to put in a higher lux level when you start off, so that you can make use of it for a longer period of time. So other projects we've done to date, this is one of our mechanical engineers called Andy Cunningham. He's been very instrumental in changing a lot of our coal and oil-fired boilers in hospitals. So all our facilities have basically now switched over to heat pumps or other forms of heat generation, apart from Groote Tygerberg Hospital, Lentegeur, as well as our nursing college. We are busy looking into a possibility of maybe just changing the boilers at Groote Hospital to make them more energy efficient. So that means that we will be using less coal at Groote. We are also looking into ways of maybe changing the boiler fuel at Tygerberg Hospital, so maybe see if we can use biomass in that. Lentegeur and the nursing college's boilers will remain as is for time being. This is just heat pumps and direct electrical heating. So it is closed loop system. So we use the heat from the heat pumps to heat the water at the autoclaves, so that it's a closed loop system, and very little heat actually gets escaped. So it's basically waste heat recovery that we use. It is at hospitals such as New Somerset, where this is being used quite successfully, and Andy Cunningham has been very, very good at installing all these different projects. We've changed the laundry equipment at Lentegeur Laundry, and this has been very successful. So we've saved quite a lot of water, and you can see how much CO2 as well as the cost that we're saving. This is not a tiny little laundry. It's about 700,000 items that get washed every month. This laundry basically serves our southern suburbs hospitals. So that would be your Mowbrays and Khayelitsha, East River. All of those washing and laundry will go to this particular laundry in Lentegeur, which is in Mitchells Plain. So we're a firm believer in what you can't measure, you can't manage. So we have installed remote meters at all of our hospitals. So all 53 of our hospitals are equipped with remote metering. We also measure some of our larger clinics as well. So we've got energy profiles, we've got demand profiles, we've got the ability to set up alerts for when we're going to hit max demand. We've got time of use profiles. And also tariff reports. There are some tenants on the facilities that are not health facilities. So we are able to do it could be interdepartmental billings or just other tenants that is on the property that we can provide them with, that we can provide them proper accounts, which is based on a municipal tariff, but B, the actual consumption at the facility. And just to show you what it looks like, we've got a SANS report, so a SANS 204 report, which is extracted. If you look at the bottom right, in the middle, you'll see the A, B, C, D, E, F, G. That is basically the same as you've got, the same sort of energy ranking that you've got for fridges and washing machines. We basically do that for all the hospitals, and when you also rank them against each other, but you cannot compare a Tygerberg hospital that's got 1,400 beds with a smaller regional hospital that's only got about 30 beds. So we cluster them together. We cannot measure a TB hospital against a large central hospital. So we cluster the TB hospitals together, we cluster the psychiatric hospitals together, and measure them against each other. So there's just a load profile dashboard, so you can see what the consumption was. It's basically a 6-week average that we've got here. And then we've got some plans to do renewable energy. So with our audit reports that we've got, these are the 12 hospitals that we would like to do energy efficiency at. So we first want to make sure that all the hospitals are energy efficient before we do any PV. But these hospitals have proven to be a very good candidate. All are very good candidates for energy efficiency, and we are just waiting for their baseline reports. And it's also possible to do quite a bit of PV installation at all these facilities. So the reason why we want to make sure that the hospitals are first energy efficient and then go over to PV is because otherwise you're just overspeccing your PV anyway. It's similar that if you're never going to do augmentation unless you fix the leaks first. So that's the same with electricity. Make sure your facility is optimal before you change over to any form of renewables. So our initial estimation is that the reduction of the grid will be about 5 megawatts for about 4 hours. That's what we said we can actually, wouldn't say guarantee, but that's the big possibility to do it for 4 hours. And that will be enough to provide power to approximately 3,200 homes. We are really looking to see if we can maybe reduce some Eskom stages. If we, the more our projects we can do. We also have massive awareness campaigns as well going on at the department. So we're not just looking at electricity, we're looking into water as well. Reonet, which is our ESCO partner, is also our water ESCO partner. So they are looking at saving water at hospitals as well. A lot of our hospitals are equipped with boreholes. So in terms of sustainability, if anything happens, this is basically because of the drought we had a few years ago. So we had to install boreholes at all the different hospitals. Some of these boreholes are actually equipped with purifying plants, and we now need to go through our compliance processes with the applicable municipalities to make sure that we can actually use these boreholes as opposed to be reliant on municipal sources. Then we've got 4 hospitals that are currently being investigated for shared savings possibilities: New Somerset, Karlbremer, Lentegeur, and Grooteschuur. It seems like Karlbremer and Lentegeur is definitely big possibilities to do shared savings at, which is great. So we can start implementing initiatives to share water here as well. So just to give you a quick indication of water savings is typically done through, demand management. We do water management in terms of pressure management. We do desectionalization if there's areas that doesn't require water anymore, that gets cut off, and also a lot of leak fixing and just infrastructure repair. So that's basically what we do with regards to water savings. For waste management, we've got medical waste, and that obviously needs to be treated in a very responsible way. And we've installed 10 alternative heat management systems throughout the province. We call them Newsters, and the Newster is basically it. So all the bandages and everything, there are big red bins throughout all the different hospitals, and these bins are used to dispose of, bandages, syringes, not the needles, but the syringes, the needles, and those sort of things that gets thrown into the Newsters. And it's basically a machine that spins around. So there's blades in there and it spins, and it reaches about 150 degrees. And because it's so hot and because it starts shredding all the material, it will come out as sterilized. So you can see the Newster on the left-hand side. That's what it looks like. And there's just the control panel on the right-hand side. And it basically comes out as fluff. You can touch it. It's sterile. Nothing will happen to you when you touch it then. And we're saving quite a bit of money with regards to waste collection, because we don't really now need a proper waste management company to go and collect this. This waste is actually now safe to go to a normal landfill. But we can't just rely on Newsters to do waste management. Effective waste separation is absolutely the way to go. So your biohazardous waste, which will go into the Newster, the box on the right-hand side, that is for your bandages and swabs and whatever. Your middle bin here is going to for the sharps, your needles, and the left-hand side is your normal bin where you just put in papers and sweetie wrappers and whatever. And this is a very effective station. It's been in operation since 2020. It is actually at the emergency room at Kolbremer Hospital. And, if it works at an emergency room, waste separation will work everywhere because it's convenient. The reason why we put it at a tap is because that's where a lot of the doctors or nurses or whoever will walk around. They will quickly go and wash their hands and then chuck whatever they've got with them, whether be needles, because if they've just taken blood or something like that, they will just chuck it in the appropriate bins. So we've done a lot of awareness campaign at the department. One of the things we showed them is that we use 160 gigawatt hours of electricity per annum. This is what we've used last year. But what does that mean? It's not tangible for anybody. Nobody knows how much that means. There's only the very clever electrical engineers will understand this concept. I don't. So I made it easy. So in terms of LED TVs, it's 730,000 TVs. It is 6,400 soccer stadiums that are properly lit up. It's 13 shopping centers. That is the amount of electricity that we are consuming per annum. And that is why we are trying to show to our employees, we've got 33,000 employees. If every one of them can just save 10% of their electricity bill, we already can make a massive, massive difference. Not just, and I'm not even talking about saving it at home, at work. You can also save it at home. There's plenty of opportunities to still save. And that is the message that we're trying to get across. Yes, we can do yes, we can do renewables and all of that, but energy efficiency is really where a lot of the potential for electricity and water saving is actually lying. So just to show what we've also got doing in terms of our awareness campaign, our ESCO partner is also part of this. So we've got a sticker on the left-hand side that goes over a light switch. Even though we've got the occupancy centers in place, we would still like people to be aware of, switching off the light when you leave a room, that sort of thing. Save energy. We've got all these posters up, and the right-hand poster in terms of, boiling the kettle for only amount of water that you require, turn off appliances when not in use. All of that is also in line with our departmental energy management policy. We've also got a whole climate change made easy sort of webinar series that we've got going. I think we've had about 4 to date. This is people from various for all over the department. I recently did a presentation to all the nurses in the department. There was a clinical nurses conference, so it's a big awareness for everybody. It's not just focused on all the technical staff or the facilities management staff. This is much broader. Our usual message to them is, you do the medicine, and we will do the retrofitting and whatever is necessary at the facility. But please, switch off the light when you leave the room. When you leave the clinic, make sure the lights are off, the HVAC or the air conditioner is off. That sort of thing. We work together to make sure that we can save electricity. And then we've got an internal program called Sinjani. And Sinjani is where we used to capture, things like TB, HIV, all these type of things, all these illnesses at particular hospitals. But we now also want to expedite it to include municipal bills. So we can not just have remote metering, but also have a proper one-stop shop to where we get electricity and water, as well as waste measurements that comes directly from the utility bills, just so that we can start to build up some profile. We can see where there's deviations. This program very cleverly has deviations flags built in as well. So if there's a deviation for about 10% or so on an electricity bill, we can really look at this facility and see what's going on there, and maybe contact the facility staff and ask them what is happening on site. So our net zero strategy is based on basically 4 pillars. So the first one is to plan, design, and build operationally efficient and functional buildings. The second one is to reduce operational energy usage in existing buildings. The third is to increase renewables energy supply. And the last one is to offset remaining carbon. So I don't know if you're aware, but there's quite a lot of interesting things going on with regards to the carbon market at the moment. There's 1 or 2 sharks out there, so you need to be careful what you purchase. There's also other possibilities to maybe look into things like biodiversity credits, whereby you restore the actual biodiversity of a specific area prior to any sort of human intervention. And there's also the possibility of looking into renewable credits. And as healthcare facilities are social facilities, this could be a very good way to maybe fund future IPPs, independent power producers, to make the financial model more viable. So if you look at our designing of buildings, there's the previous deep internal space one. If you look at the color one, that is one that is heavily dependent on HVAC and heavily dependent on quite a lot of artificial lighting. So if you look at the narrow footplate, which is the one, the black and white one, if you can see there, there's a lot less requirement for artificial light, because you actually have a lot of external sunlight that comes into the building. There's also a lot less need for a lot of cooling or heating at that particular facility. So we're trying to make sure that our designs of buildings are narrower and more fit for purpose for specific areas. So we've got a whole policy in place to build new buildings, which is called our 5L agenda. So it's got to be long life. It's got to be look at sustainability of a building. It's got to have as low impact on the area and the environment as possible. So in other words, reduce the carbon footprint. It's got to be loose fit, so it's got to be adaptable to the particular area. I'm going to have luminous healing spaces, and then a lean design. So which means that narrow footplate that I showed you in the previous slide. So we want to make sure that our hospitals are climate friendly. Just as a side note, if healthcare were a country, we would be the 5th highest emitters of carbon into the atmosphere. So we're a pretty high consumer of carbon. So lastly, what can I do as a person? You know, even if you don't believe in the whole carbon climate change thing, that's not what I'm here for. I'm not trying to explain to you. I'm not going to convince you. All I'm saying is there's tiny little things we can make sure that we don't waste, and we can do a lot to have a lower impact on the environment. I mean, if you look at around and you see all the papers and everything on the street, I mean, that's really that's not a look nice to look at, and B, it's actually not very helpful to the environment. But we can do something. You know, we all have a carbon footprint. We can all reduce it. Switch off and save, that is a big thing, and that's easy to do. You don't have to spend money to switch off a light. You'll save money when you switch off the light. There's lots of these tiny little changes that we can do. You can maybe reduce your fridge set point, make it a little bit high. Your fridge will still be cold and will still keep your cool drink cold, but you won't use as much electricity. Even, you know, when you cook, you can maybe use a lower heat, but cook it for long, you know, bake it for longer in the oven, or use an air fryer. There's plenty of other things you can do to save electricity. One of the other things, we can buy less things. You know, we've got so much. We don't need 20 pairs of jeans. I mean, we can do with, you know, eight or so. We don't need that much. You know, and think about your food. I'm never going to tell anybody to become a vegan. I am not a vegan. I do like my meat, I must admit. But choose a bit of a flexitarian diet, so whereby you use less meat. So whatever you buy that's on your plate, make sure that it's less meat and more veggies. It's healthier and cheaper anyway. So just that tiny little change that you can do has a massive impact on the environment. Only buy fruits in season. I mean, when you buy an apple in summertime when it's not supposed to be bought, you know, it tastes like carbon anyway. So it tastes like cardboard anyway. So, you know, why would you want to do that? So buy the fruits that are in season. And again, it's cheaper. Sustainable seafood choices. You can look at Sassy's website and it shows you which type of fish is more friendlier to the environment. So something like a hake is always a better option than a sole or something like that. Again, tiny things we can do to have a massive impact. Also try to see if you can maybe reduce your plastic consumption. There are quite a few places around now whereby you can take your old plastic washing up liquid or so, and you can just replace it, and you don't need to buy a new container. And lastly, we can also hold businesses accountable for their environmental commitments. As a government, we can really start looking into ERP, extended producer responsibility, so that when something gets disposed, it's their responsibility to look at the disposals. And then lastly, I want to show you your cheat sheet, just what the cost of electricity is. So what is your TV cost and your kettle and your hairdryer? So this is based on the City of Cape Town's prepaid domestic rates. So for every kilowatt hour that we consume, there's 95 liters of water that is used to actually generate that kilowatt hour. And that's a half a kilogram of coal per kilowatt hour. So if you have your oven on for an hour, you've basically used a half a bag of charcoal. Now, just to put that in perspective for you. So this is basically what electricity costs you, and this is what, just to give you an idea of your consumption at home. Okay, and yeah, this is a presentation. So if you have any questions, I will gladly answer you.
Thank you, Martjie. Thank you so very much. Fascinating stuff. I like the fact that the presentation is holistic. So you're not just looking at one aspect. You are looking at different aspects. You are thinking big, but you are also looking at the small steps that we can take. The only complaint that I have was when you said less meat and more veggies, because for a minute you sounded like my mom. But outside of that, which I think is something that you should take off the presentation, but outside of that, I really found the presentation to be very, very interesting. Colleagues, there we have it from Martjie and the Western Cape Government Department of Health with the presentation around sustainability. Can I take a quick round of inputs, comments, questions that colleagues may have for Martjie? If you would like to ask or make a contribution, please use the raise hand function. I see one hand. Let's take you, Rishi.
Hi, good day. Good day, Martjie. Excuse me.
Hi, Rishi.
Thanks for the great presentation. I was just interested in that table of stats regarding the consumption of water. Just regarding that, with that consumption of water, like it's obviously like it's based on like what you're utilizing, and like sort of that's like stats that have been derived to like the amount of, like, for example, water that's used to like produce electricity. Is that like all types of electricity production, be it hydro, electric, coal?
Sorry, yeah, it's for coal. It's from Eskom, and they said it's for coal.
Okay.
It's non-potable water, but still 98 liters anyway.
Okay, and are there any like sort of stats that like show like sort of a reduction? Like I'm not too savvy on like electricity production like via other methods, but like, for example, like nuclear, is it like less consumption of water with other ways to generate electricity, be it hydro, nuclear, green, is it like less sort of, does it utilize less like resources, like water, for example? Yeah.
Well, I can tell you for every 100 watts, you use about a solar power. Solar panel, you use about 100 kilowatt worth of water. So 100 kilowatt hour to make a 100-watt panel. So that's the amount of. So there's a fair amount of water that goes into just generating a single panel. In terms of the water, in terms of nuclear in South Africa, the Koeberg is actually situated on the ocean.
Yes.
So it's making use of ocean water. So it's not water that we're never going to drink. So that water is being used for the cooling system.
Cooling, yes.
So I'm not entirely sure about the other one, so I can't really answer your questions on that. But I know that the nuclear is that. The water for hydro, I know that gets the one at Steenbras gets used over and over again. So they pump the water up to Upper Steenbras, and then it comes down for Lower Steenbras to generate the electricity there. Okay.
And okay, just one more question. This is obviously like I feel like a huge debate, and like I suppose one could spend hours debating this. Just like, so sort of, I know there's like a lot of countries, like maybe the United States and France, that are heavily reliant on nuclear. Like just like an opinion, like if we were to transition to like a state of like increasing our nuclear power generating capacity, would that have a positive effect in terms of like, okay, I know you said it's like non-potable water, but like, would it be more environmentally savvy to do that or not? Or
okay, this is going to be a personal opinion, so it's not a department answer.
Yes.
I've actually done, so I just want to make that disclaimer there. I've done quite a lot of research with regards to nuclear power. It is a very, very good source of power. It is probably the most power source that's got the least amount of waste. Because if you look at somebody over an 80-year lifespan period and if they're very, very gluttonous, and I mean, using HVAC, using lots of heaters in winter, and never ever being cognizant of any sort of consumption, and just being very, very wasteful. The waste attributed to that person over an 80-year period would be the size of a Coke can.
Okay.
So fair enough, that is very, very toxic. But these days you can burn nuclear waste, and you can burn it between 5,000 to 8,000 degrees Celsius, which means you can actually effectively sterilize it. So it is, and also the other thing, it's probably the only source that you use over and over again, because if you look at the process of how nuclear is generated, It is, tiny little pellets that basically generate heats generate heats, and then the water gets boiled, and that gets those tiny little pellets. I don't know what you call them, but they get used over and over and over again. And only after a long period of time they change that. So it's not the worst plan. It's really not the worst option. And also it's very sustainable. Remember, anything with solar and wind, it is intermittent because you're still reliant on either wind or the sun to actually be there.
Of course.
Whereas with nuclear, it's not. And you can see I don't know if you're on LinkedIn, but LinkedIn has got quite a lot of articles about how green nuclear technically actually is.
Okay, I'll have a look at it. Thank you.
Okay, pleasure.
Thank you, Martjie. Great presentation. Right. Thank you so much.
You.
Thanks, Rishi. Next, we've got Elaine, and I'll also take advantage and raise my 2 questions. Elaine, I'll go after you.
Thanks, Boitumelo. What a really fascinating presentation. Boitumelo, you always bring the best people to these webinars. Thank you so much. I have one. How long has your health infrastructure program been running? In other words, it seems like you're really making progress, but how long has it been, or how long has it taken to get to this point? And then my second question is, do you have any statistics, data, any indication of how other provinces are comparing, whether they have also embarked on this health infrastructure approach or not, and if yes, which ones? Thanks.
Okay. Okay, so I'm going to answer your first question. So Andy Cunningham has been our chief electrical engineer. He's retired now, but Andy has been doing this at least since 2000. So where he started with all the coal and oil-fired boilers, he's changed that. He's very much passionate about equipment and making sure that everything is efficient. Our remote metering data dates back to 2016, so it's been going for a while. The ESCO program as such that I've showed you, that is our main vehicle for net zero, has only really started the last year, 18 months. So it hasn't been, we've only really now started getting really lots of traction to get the facilities to become more energy efficient. So it's been a while, but also not that long. With regards to other facilities, other provinces, I know we are the only province that is committed as a province to GGHH. Some of the other hospitals have, in other provinces, has committed as a single hospital, but and I think that is in Free State, Gauteng, and KZN. I can't unfortunately tell you which hospitals, but I know that some of those have committed. I know there's been quite a lot of work done in KZN, but I'm not quite sure. That's just in passing. I've spoken to the electrical engineer at KZN once, and I just asked him what he's doing, and he said that they've been working quite hard at KZN as well. But I'm not sure. I can't speak for any of the other provinces. I haven't had engagements with them. So, I just want to really say that I don't know what they're doing because I haven't spoken to them.
All right. Martjie, are you okay? Yes, I can see you. All right. So I've got 2 questions, and the first one is a procurement type question. When you were talking about the ESCO, you mentioned that it is a performance contract.
Yes.
And what I need to know is, how do you get into that kind of a contract when you don't necessarily know upfront what are the kinds of savings that you are going to get from a facility or from the initiative, whichever one it is? And the second issue, when you were talking about, this is on slide, I think 8, when you presented, when you were talking about the baseline and the what the contract, and you were looking at the savings, how I read that was, it's that we know what the baseline is, and all you have to do is to come up with some kind of, it's a reduction in savings. What it was not necessarily talking to is, while you may reduce the, your emissions or whatever, from the baseline, your demand for power, because in this case it was electricity, can actually go up. So while we are talking about reduction in the baseline, are we also looking at the possibility that your actual demand might also be going up? And how do you tally those two factors?
Okay, all right. Now, thank you for those questions. They're very good. Both of them are quite good. So we're actually looking into having a new ESCO contract, whose ours concludes at the end of November this year. Yes, that adjudication for price is quite interesting, because we're actually not spending money. We are looking at how much people will invest in us. I will gladly share some information with regards to that. I was unfortunately not part of the actual adjudication for the first contract, and I'm also still learning how we're going to adjudicate it on the second, on this new contract. So I can share that information with you as soon as I get that, if that is in order. What I can tell you is that when the previous contract did have different types of percentages. So if the savings is, for instance, over 2 years, there's a certain percentage that they will share. And so it's not necessarily a 50-50 percentage. There could be a 45-55 percentage. So there was a whole clever pricing model that was done by the Department of Public Works and Transport when they initially went out on this. So I can share that information with you as soon as I get it. We're actually going to meet with the previous director, with the supply chain manager there, and he will help us with getting that information. And on your second question, I neglected to say that the baseline that we set about is not just based on the kilowatt hours, on the consumption. It is also based on the demand. And usually when the demand, both of those items at a municipal bill are actually measured. So we take the current municipal bill. So what we do is three Januaries in a row. So we take 3 Januaries, the average of 3 Januaries, and when we get the January bill, we compare the January bill, the consumption as well as the demand, and then there's an invoice that will be raised by the contractor to us.
No, I think thanks for those answers. It's becoming clearer, not completely clear, but clearer. The thing that I'm still battling with is, if you are a contractor, how are you making your money? Look, I understand that you can look at the bills, the savings and whatnot, but depending on how much investment you have to put in, and you have to recoup that, of course, that comes also with costs and the like. It's not entirely clear to me, how contractors are able to monetize those savings, cash flows over time, and say, yeah, it is worth our while.
Okay. All right. So they take the consumption and they see what it is at the moment. And they will go to the lights, for instance, and they say, okay, the lights is, we've got, say, 100 watt lights. And now we're going to replace them with, say, 10 watt lights. But these are burning for 8 hours per day. And then they take that and they multiply that 90 watt by 8 hours by the rate of the actual bill. And that is how they determine the savings. So they determine that, so they estimate how much they will be able to save in terms of kilowatt hour as well as demand, and then they multiply that by the applicable rate of the municipality, and that's how they get their savings. But again, we can maybe share you some of the financial models that you can see what it looks like, just so that you can see how they show it and how they plan on saving it. But that's usually the contractor that will work out that. And some of the interventions are cross-subsidized against each other. So lighting, for instance, could be 5.5 years in terms of the payback, but your heat pump solution could be 3 years. So it will bring back down that one. So they cross-subsidize, and you basically get a weighted average in the end. But I think I can share you one of the audit reports that we've done, for instance, for Eerste River, and then you can see what the funding looks like.
All right, I think that would be very interesting. I don't see any other hand. Let me just confirm. Anyone who would like to ask anything? Otherwise, we are going to close. Any inputs? It's clear.
Okay.
Very clear, Marty. I think on that note, I would first like to thank you for availing yourself and sharing with us such fascinating stats and initiatives that the Western Cape Department of Health is doing around some of these things. And I also think that you should be having a lot more conversations with other provinces as well as national health in terms of rolling this thing across the country, because sometimes it doesn't really help when you've got the one hand which is doing great things and the others not necessarily pulling in the same direction. It's one planet at the end of the day. So I really encourage you to continue having those engagements with the other provinces and the sector as a whole. And to all the participants, I really thank you for your time and for engaging with us for one more week. We shall meet again next week, Friday, same place, same time. Thank you. The meeting is adjourned.
Thanks, everybody. Thanks.
Thank you. Thank you very much.
Bye.
Bye-bye.